This is video 2 of 5 in the ketamine-assisted psychotherapy process series. In this video, we'll be discussing 3 things relevant to the preparation phase, which is prior to the actual day of your ketamine journey. The 3 things we'll cover are planning and expectations, intention setting, how you will receive the ketamine. Taking time to properly prepare for ketamine-assisted psychotherapy is the first step in setting yourself up for the most meaningful experience available to you. I will support you throughout this entire process. The length of time you will need to prepare for your first actual ketamine medicine session will vary. For some people, this may be one preparation session, while for others, we may have multiple preparation sessions. The reason for this variability will be informed by the treatment plan in which you and I will co-create. You will be involved in these decisions. Yes, it's true that I am an experienced licensed therapist who is trained in ketamine-assisted psychotherapy, yet the potential healing is there within you, and this is a collaborative process. Regarding the number of recommended ketamine sessions, it's best if you can commit to a series of sessions between 6 or 8, at least 4 at a minimum, because each session will be a different experience for you, like adding different pieces to the puzzle. With that said, you're in charge of the number of sessions you receive and are able to stop at any time. Here are some things we'll be reviewing in the preparation phase. Discussing expectations and the possible experiences you may have, what the environment looks like where you'll be doing the ketamine medicine session, and the role of music. Setting an intention for ketamine-assisted psychotherapy sessions is not only relevant in the beginning of this process, it is also a theme that carries all the way through to another part of the process called integration, which we'll be discussing in a later video. Here are some example questions. What are you wanting to work on? What are your worries? What are you grateful for? What would progress look like for you? There is a level of flexibility around this process that we can customize in a way that works for you. How you will be receiving the ketamine medicine is something that you will have already discussed with the prescriber. Yet, I thought it made sense to share with you in this section as well. The first way you can take ketamine is through the mouth, orally. It comes in tablets or waxy, square-shaped things called troches, or you might take it as an oral liquid solution. Regardless how you are taking this orally, the important thing is to note is that ketamine will be absorbed through the mucous membranes in your mouth. What does this mean for you, you ask? It means you will need to hold it in your mouth for a period of time, around 12 to 15 minutes, and be prompted by me to switch it around in your mouth every now and then during that time. Since it's absorbed through the mouth, at the end of the 12 to 15 minutes, you can either spit it out or swallow it. We'll clarify what you want to do prior to taking it. The second way you can receive ketamine is through an intramuscular, IM for short, shot. It's typically administered in the shoulder muscle. Now, if you're receiving ketamine in this way, it won't be giving yourself a shot like I just demonstrated. It will be administered by a licensed medical professional. The third way you can receive ketamine is intravenously, IV for short. Just like with intramuscular, this will be administered by a licensed medical professional. There are pros and cons to each of these 3 methods I just described, and it's beyond the scope of this video to go into more detail. Just know that we will have definitely covered all of these options well in advance during our preparation sessions. Next up, what to expect on the day of your ketamine journey.